but I'm afraid of lashing out, or if I get told I can't eat my favorite thing anymore, I might have negative behavior. I know they are doing it for my own good, but I don't like being controlled. And I don't want to embarrass my mom and my stepdad. Please help me. Bless your heart, Parker.
So I love that, Parker, and thanks for, like, what a timely question, because I mean, you bring up a really good reminder, which is for all of us, one of our, there are two types of, there's multiple types of reinforcers, but there's secondary reinforcers and primary reinforcers. And secondary reinforcers are all the things that are associated with primaries, like, for instance, money. Money is a secondary reinforcer because on its own, it's just a piece of paper or a coin, but the reason that it's reinforcing or rewarding is that we can buy things with it that are primaries. And what are primaries? The most important primary is food. And so we become very, I guess, defensive when someone tries to control our food. It's a natural response because it's what our lives depend on when you go back historically, right? So knowing what you know, Parker, like knowing, as you know, you're very aware, you're someone who analyzes behavior. I want you to go into this meeting realizing that this is for you. All of those people are there for you. They're not forcing you to do something, they're assisting you. It is your choice. And I assume the reason that you're going there is because you want better health. I don't know if it's because the diet is important for your weight, for maybe cholesterol, for just gut functioning, for inflammation, whatever it is something that is going to make things better for you. So you're choosing this, or before you go, choose it, because it's for you. It's not forced on you. It's something that you are choosing because you want to have a better life. You want to have a better day-to-day existence and health, right? So that's one thing. The second thing is just tell the doctor or the nutritionist when you get there, tell them, I'm really sensitive to this issue around food. I don't like people telling me what to eat or not eat, so I'm going to be defensive about this. Please help me get through this. Like, just tell everyone, tell your parents, tell the dietitian that this is the way it is, and then take it and like make it fair. Sometimes dietitians or our parents forget or don't realize what you need in order for it to work. Like, you know, when we do diets, I often, if I'm like gaining weight and I want to lose weight, I will set a time frame for myself and I'll say, okay, I'm going to do this diet, which I know works for me. And the reason that it works for me, by the way, is that it allows me to have sweet protein bars, which is a thing for me because I have a sweet tooth and I need to have sweet in my mouth every few hours. So all of this is fine with me, but I can only do it for 5 days. And then after 5 days, I will have like 1 day where I don't restrict myself. You have to make it fair for you. I mean, one of my friends actually just recently did a 30-day liquid cleanse, and I would have killed myself. Like, I can't even think about a liquid for 30 days, just drinking liquid, right? And she lost tons of weight, but I couldn't even do that. So you need to tell your mom and stepdad, you're not embarrassing them if you explain ahead of time that you are aware that you become defensive over this issue. It's a very, very normal, natural process, and tell them to help you get through it.
And you know, I just want to say too, Parker, that you know, I hear you saying that there's a favorite food that you want to have no matter what. And I'm just going to ask you where your willingness is and flexibility of, are you willing, you know, because sometimes what it is I don't know what that favorite food is, and you can write in and say what it is. But for instance, you know, people go, well, I just have to have pizza. But you know, you can change some of the ingredients in the pizza. Like,
that's also true.
You could make it the low-fat cheese, or you could do the cauliflower crust. Or I know somebody who makes a zucchini crust where she just slices zucchini and puts it down and then she puts the sauce on top of it and a vegan cheese on top of that. And it's the calorie count on it is wildly different because you've changed an ingredient. And it might take a little while to get used to that. But, you know, it really becomes like, what is the thing about the food that you want? Is it the flavors? Is it the crunch? Is it the whatever?
Is it just the sense of security sometimes?
Yes, because I'll bet you that you can get it in a different way that's healthier for you.
Sure, absolutely.
Like, I love hearing that you're a sweet girl. I'm a quantity girl.
There you go.
If I had to live on one of your protein bars, I would run screaming into the street with my hair on fire. Because I'd be like, no, you need to put
I just need lots of it.
Like, you know, put a pound of raw cauliflower in front of me and I'm happy.
There you go.
And I'll nosh on that forever. But give me, you know, a sweet treat. I'm going to eat 30 of those protein bars.
Everybody has a different thing.
Yeah.
But you know, the basis of this, and this might be useful to all of our viewers, is as human beings, we will always select something that's going to be a short-term reinforcer before we select a long-term reinforcer. And that's just life, right? And that's one of the things we learn as we're growing up and maturing is the difference, right? When you're a child, you will request milk and you will cry until you get milk.
Yeah.
So you want that instant reinforcement. I want my milk and I want it now. Or I want to go out and I want it now. I want that toy in the store and I'm going to cry until you get. So it's kind of like short-term rewards, right?
Yeah.
But when you get older, you learn to adjust because there are not that many short-term rewards in life, and most rewards are long-term. So you go to work and you will wait 2 weeks to get paid. You know, you will go to school for whatever, 4 years or so in order to get a degree because that in the long term will help you get better jobs. So it's kind of like we become all about long-term reinforcers. What you have to do here, and in all cases where it's hard, like I use this example a lot of times with parents because they let like when the child is screaming or tantruming, you'll let the child come and sleep with you. Because in the short term, that's very rewarding. You don't have to deal with the tantrum that night. You know, it's comforting to have your child. You feel safe, they feel safe, etc. But in the long term, it's not at all good. And a lot of times, we choose reinforcers that are short term good, long term not so good, like food.
Yes.
You know what I mean? And because we just don't see the long term. And if there was a way that you could keep reminding yourself of the long term, like in other words, hey, if it's for cholesterol, let's say, watch your cholesterol go down, like go every week and see a doctor and check your cholesterol regularly. Or if it's for weight, make sure that you are watching your weight and so on. Because as connecting it to this is what I want to feel like, this is what I want to look like, this is always going to help.
One of the talks this weekend at the conference was about exactly this topic, about finding the balance of short-term reinforcers and long-term reinforcers, and that is the only compassionate way to treat.
Absolutely, and it's the only way that succeeds. Shannon, if you think about yourself, ourselves in life, if we only have long-term reinforcers, we're going to lose our minds.
That's right.
The short-term ones that we get are like, hey, every afternoon, evening, I'm going to sit down and watch a favorite show.
Yes.
Or whatever it is. Those are the short-term ones that keep us going.
And if we only have the short-term, that's not good. And if we only have the long-term, it's not good.
Exactly.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.